Krystal, a student nurse here at the hospital. I'm here to give you your IV. Can I get you to say your name and date of birth? Alright, that's what you have on your armband. Like I said, I'm giving you an IV. This is to give you fluids through a catheter because you're dehydrated. We'll be putting normal saline in you because I checked that with the doctor's order. I'll do my hand hygiene and apply gloves. Have you ever had an IV before? No? Okay. And if you had an IV before, I would ask them the preference, which hand he had it in, and how it went, number of tips, if he knew. And I'd ask if he was allergic to latex or any medications, and he's not. Alright, now I'm assessing his veins to choose which one I'd like to do. And this one in his hand seems appropriate because there's no knots or anything in it. So I'll apply his tourniquet 4 to 6 inches above the vein that I'd like to go in. I apply it tight. Oh. There. Okay, and it's elastic. I will need to open this. As you can see, I have all of my supplies in order over here, prepared and ready to go. I've flushed my tubing prior. Now I can clean the vein I'd like to go into. Allow that to dry. Put this in the sharps container. Alright, it's dry. So now I take the IV needle and look for the bevel up. Insert it into the vein. 10 to 30 degree angle. Observe for flashback. Occlude the vein and retract the needle while I am inserting the catheter, advancing it. Keep it occluded. And I'd keep this sterile. With the needle, I'd put it in sharps container. I'd tape to stabilize this. Tape to stabilize. Keep this sterile. Release my tourniquet. And then flush the vein. Make sure this wasn't clamped. Alright. Now I'll apply my Tegaderm. And make sure it's on the skin tightly and smoothly. It's just not so easy to do on this fake arm. And then I've already initialed and put the gauge on there, 22, and the date. And and I'd apply this on the side so we could be able to see the site. Then I'd come over here. I'm gonna clamp this back because we're not providing fluids right now. I'm gonna secure this. Yeah. Secure that. Take that off. I would choose the correct tubing. So primary tube, I'd keep it sterile. Hang my bag. And I check it with the medication, the 5 rights, which is right patient, right drug, right dose, right time, and right route. And I would take this part and make sure it's all clamped and everything. Okay, it's all clamped. Now, puncture my bag. I'd milk it. Make sure it's halfway full or so. And prime my tubing. I have to keep it above waist level. Make sure there's no kinks in it or anything, and that fluid's all throughout it. I already have my alligator clamp on there. Now it's time for me to unclamp this and hold it over there, the trash can. Then prime it. Okay. It's primed. There's liquid coming out. Normal saline. Okay. Clamp it up here as well. And come over here to my patient and attach it. Before attaching it though, I'd wipe it with alcohol to ensure cleanliness. Okay, and then I'd unclamp it there to allow fluids to get to my patient. And tape it up here to secure it. Alright. Then I tell the patient that the call light's over there and we have fluids going, and if she has any discomfort or pain in the area, to please let us know. We'll assess it. And I'll come back and let her know, check on her and everything. So then, and that's it for the administering the IV. And then to remove the IV, I'll come in and tell the patient it's time to discontinue fluids. So I'd clamp this, and then I'd clamp the fluids here to make sure no fluids are going in because we're discontinuing it. And then I'd perform hand hygiene before this process and apply gloves. Then I'd remove the tape. Then I'd remove I'd take this off to get out of my way. Then I'd pull the tegaderm off by pulling in the direction of the hair. And toward the site, I'd remove the tape. And then I'd